To all the women out there, do you know if your estrogen and progesterone are in balance? Well, we are talking about female sexual hormones today with Dr. Anna Barbieri, who is MD in OBGYN. So hold on everyone, and having Dr. Anna come, and she's going to talk about female sexual hormones today. So it's a very interesting topic. And Dr. Anna, here you are. Hi, welcome, Dr. Anna. How are you?
Hi, I'm good. I'm glad to be here. Very exciting. Happy Friday.
Happy Friday to everyone, to all the viewers who I see them joining. And we have a very interesting topic today to all the women, and the guys are welcome to join too. Female sexual hormones. That is the topic, everyone. And here we have Dr. Anna Barbieri. She is MD OBGYN. She is integrative medicine doctor from Andrew Weil. She also has been a professor at Mount Sinai. And I can go on and on. Dr. Anna, maybe you can tell us a little bit about yourself.
Well, so welcome everybody. I'm excited to talk about this topic, especially since Valentine's Day is coming up, right in a week. So sex and sex hormones are on our minds. But yes, I am a board certified OBGYN. I've been in practice for actually almost 20 years. I delivered babies for a very long time, but I stopped doing that a couple of years ago when I got really interested in hormonal health in particular. And I wrapped this knowledge with my interest and really passion about integrative medicine, which really means not just using the typical prescriptions and surgery and all of that, but really looking beyond that at natural approaches, which may start even with how we think of ourselves, to how we eat and feed our bodies and our minds, to things like sleep and stress reduction, and natural remedies too that have evidence behind it. So really in my practice, I use kind of the whole range of tools. And I think especially with something like, sexual issues, it's typically not just about one thing. Our sexual health really is complicated because we're complicated as women. And we really need to take a look at it from all these different angles. So I no longer deliver babies. I focus all of my life professionally now on gynecology only and hormonal health in particular.
That's amazing, amazing. So let's get to about our female sexual hormones. What happens to all of us? This estrogen, progesterone, testosterone, we don't understand. So help us, just give us the framework.
Yeah, so, our hormones, like we said, are very complicated. And I think we got to start by kind of realizing that we humans have lots of different hormones. Like we have more than 20 hormones going on all the time. But the primary sex hormones for women are really estrogen and progesterone. They mostly come from our ovaries, right? They sit there, the glands by the uterus, although some progesterone is made by adrenal glands, and testosterone. So these are the main three. But it's also important to realize that they are very related to some other hormones, like thyroid, right? Thyroid is the hormone that controls our sort of cellular mechanism, like cortisol, which is our stress hormone, insulin, which is the hormone that regulates blood sugar. So our sex hormones, yes, those are the main ones, estrogen, progesterone, and testosterone, but they are not the only ones that contribute to our sexual health. All hormones exist in this sort of hormonal harmony relationship where we have to pay attention to them. What happens to them? Hormones first, all these three tick up during puberty in our premenopausal years. So when we're having regular periods, and of course, irregular periods, that's a whole other hormonal state. So that's a whole other live we could do. These hormones kind of ebb and flow with every cycle, but they are pretty predictable. Now, of course, there are things that can affect them: chronic illness, fatigue, stress, certain medications, being pregnant, breastfeeding a baby, all of that. But as long as we don't have those factors there, eventually these hormones change during a process called perimenopause. And that's when we start really to see major alterations in how our bodies make these hormones. Progesterone starts to go down first. Estrogen becomes really wacky, gets all over the place. This typically starts to happen in our early 40s, sometimes earlier for some people. And testosterone goes down also. Testosterone actually starts to go down naturally from our late 20s on. But it's a much more gradual decline than the other ones that really start to get very funky, mostly in our 40s, when we see decline in progesterone, erratic estrogen, until we move to this phase when both of these are really going down until they reach a pretty low but steady level after menopause. Now, does it mean that menopause, forget it, because these hormones are down, so no more sex for us? Well, no, because our sex lives are much more complicated. So believe me, everybody, I've had plenty of patients that are in their 60s, 70s. I think I had one 90-year-old patient before that still are able to enjoy their sexual lives and are sexually intimate. So we can't think of menopause as like the end of everything, because although these hormones are important, they don't tell the whole story.
Yeah, no, this is funny, what you said about the 90-year-olds. So, you know, I mean, at least in the media and all the things that you read in the papers or movies, you know, menopause, like when the women hit menopause, it's like, okay, now you got to start going to some ashrams or something, you know, retire your life.
See, I don't think that at all. I think menopause is just, you know, it's a natural transition, right? So it's a transition like puberty or like pregnancy. And we kind of become these sort of new versions of ourselves through it. But sex is an important part of life, and hormones are an important part of life. And we have to know that menopause should not be just this terrible end. It's really a transition to a new beginning. And we have to kind of be armed with the knowledge of how to live these vibrant and thriving lives.
Absolutely. So you talk about female sexual dysfunction, you know, on your blog and everything. So what happens in that? What attributes to the sexual dysfunction?
Yeah. So, you know, sexual dysfunction and sexual complaints are very common in women. And it actually, you know, they exist. You don't have to be in menopause to really not be happy with your sex life, right? We see plenty of women who are premenopausal complain about them too. The statistic is actually that about 40% of women will have some level of low satisfaction with their sex life. But few actually bring it up. So I would encourage everybody out there to really think about it and bring this topic up, because sex is a big part of our lives. It is a big part of relationships, and it's just part of our health as human beings. So let's not be afraid of this topic. So it's a pretty large portion of women. Now, on the other hand, just because someone is not having sex, it doesn't mean there's something wrong with them, right? So I sometimes have patients who are like, oh, you know, my relationship is great, but, you know, my husband and I, we haven't had sex in a year, but we're doing great. Nobody is bothered by it. Well, that's great. Nobody says you have sex 3 times a week to be happy, right? So it's really when the perceived issue with sex is causing somebody distress or problem, or there are relationship issues, things like that. But sexual dysfunction, you know, it's a very broad umbrella. There are different types of it. Some women have trouble with libido, which is really the desire to have sex or being aroused by something. Some women have trouble, not with libido, but maybe with reaching orgasm or enjoying sex. Some women have trouble with pain, right? So you're 55-year-old with very low estrogen levels, when that vagina is not really lubricated, it just may hurt. Someone who has endometriosis, someone who has fibroids, sex may be painful, right? So if something is painful, we don't want to do it. That's a normal reaction. Sexual pain is a whole other area. And certainly women with a history, for example, of trauma before, with really kind of more of a psychological impact, they will have trouble with sex also, understandably so. Or even women who are on certain medications. So, you know, here in the US, people use antidepressants, for example, a lot.
Yeah.
I think we tend to probably overprescribe them, although some people really need that. So one of the side effects of some very commonly used antidepressants is low libido, and it just comes with the territory. So I think we should talk about that with people, especially whom we're treating with these medications, to make them aware what the side effects would be. Yeah, but I would say low interest, trouble getting an orgasm, painful sex, and then these situations of previous trauma or side effects to medications, those would be the different types.
Sure. So now you've switched to being an integrative medicine doctor now, from being a conventional doctor.
Yeah.
So amazing. You know, more doctors are going into integrative medicine. That's really amazing. So let's talk a little bit about how can integrative medicine help with this particular issue that we are talking about in the sexual hormones or low libido versus a conventional medicine. We know we pop a pill, but how do you differentiate yourself now?
Yeah, so you know, I'm a huge believer in integrative medicine, both professionally and personally, right? In conventional medicine, we actually don't have a lot of tools that are great tools. We have some, but we don't have as many tools to deal with sexual dysfunction as we do in integrative medicine. To me, what integrative medicine really means is that, one, we put the patient first and we look at that person as a whole person. We don't just say, okay, you need to have sex 3 times a week. Well, do 1, 2, and 3. It doesn't work like that. We really look at lifestyle and how that person is thinking, what we can do from this more mindset and psychological perspective. How can we support that patient's nutrition and stress reduction habits? Are there natural approaches that we can do that will help? But that does not mean that we never use conventional approaches, right? I send people to speak with sex therapists all the time. I think that is very helpful. I review their medications to really see if they're on something that will cause sexual dysfunction. Do they really need to be on that, and so on? I do prescribe certain things like testosterone, for example, in some cases that has been shown to really improve libido. You know, I prescribe medications like topical estrogens or HRT, and there are even other medications that are particularly suitable for libido in conventional medicine. But through integrative medicine, I'm also able to expand that toolbox. Really talk to people about behavioral things, changing their mindset, looking at sleep, looking at relaxation strategies, looking at supplements that have evidence behind them that we can consider as part of this process of healing, and so on. So I look at integrative medicine as just good medicine. It still uses the best of conventional medicine. It just adds other tools that we can use.
So you would use tools like diet, maybe some yoga, meditation, or supplements, and some of the, right? That's what, and then kind of combine that, personalized to someone whoever is having whatever issues.
Yes, exactly.
So what are the simple things like, all right, yes, you can ask a question. Someone has a question. Of course, you can ask a question. These topics are a little bit sensitive, but go ahead. Yes, absolutely.
For sure. That's what we're here. You know, I'll give you a mindset example for example. So sometimes I have patients who say, you know what, I'm 50 years old. My partner wants to have sex with me, and I just have so many things to do. The last thing I want to do is have sex with him. I don't feel attractive. I am this, I'm that. I just feel like I'm getting older. You know, one of the mindset things to practice with that
Yeah.
is really turn that around. Well, you know, you may think you're so unattractive. Well, maybe ask your partner why he wants to have sex with you. Your partner is probably going to say that, you know, he or she finds you still attractive. So look at that request as validation of your attractiveness in a way. Let's turn that around a little bit rather than being, oh my gosh, I have to like another chore to do and I have like, I got to cross off my list. Let's look at it as something that builds our self-confidence.
Sure.
I think stress reduction, sleep, self-care are tremendously important. You know, I think we women are caretakers. We take care of people around us constantly, you know, from morning till night. Let's put ourselves on that list, because when we feel better, there's just more headspace even for things like sex.
Absolutely.
Diet is super important. We got to start getting the junk out of our diets. I actually said time to get the junk out of everything, our diets, our closets, and out of our relationships.
Okay, clean up.
Clean up. Super important. So we know that diets that are lower in processed foods and sugars, that don't, you know, elevate our blood sugars up and down all the time, are much healthier, are better for our hormones, and we can actually produce them in a more synchronized, healthier way. And I do think there are some supplements that are really easy to get, that are good for other things, that may help with this directly, or at least through kind of evening out of our hormones. Things like vitamin D, things like magnesium. And we can, you know, we can talk about it because there are different types there. Things like ashwagandha. You know, this is ashwagandha is one of my most favorite supplements out there, because it's helpful with lots of things. Ashwagandha, for, you know, listeners who don't know about it, it's a very old herb that comes from Ayurvedic medicine. There are tons of studies on it. I just wrote a paper for our like professional organization, and I mean, it's mind blowing just how much this has been studied. What ashwagandha does is it actually modulates how our adrenal glands handle stress by affecting how we make cortisol. And let's remember, more stress, more cortisol, the less we want to have sex. That's how it relates to this. So ashwagandha will improve that stress response, will promote the relaxation response, will make us sleep better, leads to better well-being. So I use it quite a bit. There are also other supplements like tribulus. It will help make testosterone, which is the main sort of sexual desire hormone for us, and something called L-arginine. And there are different, you know, companies that make these supplements. These are quite safe, but whenever you start getting into some of the more specific supplements, I would recommend that you bring it up to your doctor or to your healthcare provider, because there are some small differences, and they're maybe unindicated in some cases. So we do have to be kind of cognizant of that.
I think ashwagandha, like, to your point, is amazing. You know, it's so many scientific research studies for everything. It's just like it's become like the queen herb now. Next to turmeric and ashwagandha, they are like the twin sisters. You know, that's what I see on the queen herbs here. So any type of diet, particular diet specifically for women that they should follow after they turn 40. You talked about vitamin D and magnesium, but any particular foods is what I mean. Like, should they load up on seeds or something like that, or nuts?
You know, so it's so lots of foods have been studied for sort of sexual interest and dysfunction, right? We hear all the time, oh, it's dark chocolate or pomegranates or it's oysters. Well, believe it or not, there are actually studies done on all these foods, and it doesn't seem like any of them actually do the thing that we think they do. Now, I think it's great to eat pomegranates and chocolates because they have so many polyphenols and antioxidants. That's great, but there is not one single food that will make somebody want to have sex, for example. But especially after 40, when our metabolism shifts and there's definite hormonal changes that are happening, we know that diets that eliminate that junk, so processed sugars, refined carbohydrates, so things that are made with, let's say, white flour and all of that, and diets that really promote more vegetables, more healthy fats. Fats are essential to our hormonal production. Olive oil, avocados, nuts, fish. People debate saturated fats and animal sort of based fats. I think I think for a lot of women who, once we select healthier sources of that, we don't have to reduce those to zero. On the other hand, most of our fats should come from those healthier plants, nuts, and fish sources too. To name a diet, again, diets are very complicated. It's more important to eliminate that junk, get on a sort of nutritional lifestyle that one can sustain, rather than go on a crazy diet that you can do for 48 hours and then give it up. So if I were to pick one thing, whole foods, lots of plants, mostly plants, a good amount of fat, and cutting out the junk, cutting out or cutting down on alcohol, that's the way I would go. A lot of my patients also struggle with weight loss, and I do think, keto and low carb are very popular. They are very effective. So do I ever recommend them? Yes. I think keto is a little bit extreme, and when women try to do it, getting in all that animal fat and dairy is not that great for us long term, but keto short term can be very effective for weight loss. When I do use it, I use it sort of as a bridge to a more sustainable and healthier long term sort of low carbohydrate diet that's plant based.
Got it. The combination of a lot of things, right? Proper diet that you talked about, right? Then the supplements a little bit, then stress reduction, you talked about that. That's kind of like yoga, meditation.
Yeah. And I think, I would add one more thing. I think for a lot of us still, sex is this taboo subject, right? But we have to acknowledge that it's part of life and it's part of our health. So at least we need to be kind of not afraid of it ourselves. So exploring your own biology, your anatomy, things like masturbation or using lubricants, these are things that we have to kind of get on board with to really enjoy that part of life. Like this is, this is a part of life, like just like having, dinner with friends, and it's designed to make us live these full lives.
Sure. So which hormones are released when men or women they have sex? I mean, these are the same hormones that when we do exercise or something else, right? Because it's a pleasure hormone.
Yes, right? So certainly, the three main sex hormones we talked about, estrogen, progesterone, testosterone, they kind of, we need them for our sexual response, but they are not so altered like in the moment. In the moment, yes, it's endorphins or kind of the pleasure hormones and oxytocin, right? So oxytocin is a hormone. We know about it mostly in the setting of breastfeeding. How it's this love hormone, because when we look at our babies, like we feel all this love and this outpouring of love, and oxytocin makes us release milk. Well, oxytocin sure is a love hormone, but it can be a love hormone in this other scenario too. Yeah.
Amazing. Well, thank you so much, Dr. Anna, for being with us today. I think there were so many viewers. I saw them join. Someone was asking about a question on anger management. I guess yoga or meditation or what for anger management could also lead to your sexual desires going down a bit, right? The anger.
Yeah, because that when you're angry, you sure are producing a ton of cortisol, and when you produce a ton of cortisol, you're not making other hormones that you need. And plus, being angry at your partner is not exactly the the more conducive way of engaging in pleasurable sex life.
Yeah, yeah. Well, someone's asking a question about, well, masturbation is good for or bad for boys, for guys.
I don't think it's, I mean, I don't think it's bad. I think for most men, it's kind of sort of a fact of life. I think it's, you know, I think women's and men's, and I am a gynecologist, so I don't know as much about men as I do about,
yes,
you know, women. But men's biology, when it comes to sex, is a little bit different. So they will often have a much higher physical need. And if they can satisfy it with masturbation rather than with something, how could I say it, more pathologic, right? I mean, we want our men to be in healthy sexual relationships, and healthy relationships to begin with. But certainly, you know, suppressing something in an unhealthy way or finding unhealthy ways of expressing their sexuality, I would take masturbation any day.
Well, thank you. Yeah, I hope we answered that question. Well, we thank you so much, Dr. Anna, for being with us and educating all of us about importance of sexual hormones in females. This is the topic. We were focusing on the females today. We focus on the men some other time in future. But Dr. Anna, just to summarize, I think you talked about importance of diet, supplementation like ashwagandha, making sure our sleep is better, our anger management. What else would you like to summarize before we...
I think working on our self-esteem, right?
Yes.
You want to feel, women are, again, different than men. We need to feel attractive and we need to feel desired in order for us to want to have sex. It is not like a straight road. So working on our mindset of that is, and being gentle with ourselves is really important. And having some fun while we're at it, you know, it's okay to explore this part of ourselves.
Yes, yes, absolutely. Thank you so much to all the viewers. Please share our sessions. We are bringing a new topic every single day to educate you how to live your life with integrative medicine, natural medicine. And thank you everyone for watching. And thank you, Dr. Anna, for being with us. Bye now.
Thank you so much. It was great. I had a great time.
Yes, same here. Thank you.
Okay. Bye-bye.